So let's think about what we can do as active citizens to fulfill the promise of our community and our nation. And now I'm happy to introduce David Waters.
Thank you, Catherine, and thank you to Nikki and TJ from Old North for inviting me to join you all tonight. It's wonderful to see many Old North people, many community servings people, and I have to say some of my family has joined us, so thank you as well for always supporting community servings work and cheering me on. I have some slides, so I'm going to see if technology works and I can share my slides with all of you. How's that? So I love the theme of active citizenship. And so I sort of tried to frame some of this in that context. I think that there are two stories that I want to tell you tonight, essentially. One is about the power of individuals to make a difference in their communities. I was, when Community Servings was founded in 1989, 1990, I was a young gay guy who was very scared of AIDS. And at that point in the epidemic, many young men were dying very sad, lonely deaths, but also very quick and unjust deaths, you know, if you were dying in your 30s. And I was also a young guy trying to find a way to channel that nervous energy into something positive. I think that whether you come from a place of privilege or struggle yourself to survive, we can all make change happen locally. And certainly we're seeing that in the current political situation. The second story is about a small nonprofit with a pretty simple idea, which is feeding people who are sick, and how it has grown into a fairly sophisticated research-based organization without losing its heart or its attention to its mission. So I hope you'll enjoy the journey with me. Community Serving's mission is to feed people who are critically ill across Massachusetts. We offer, as you'll learn tonight, medically tailored scratch-made meals. And we were founded by the American Jewish Congress. We were originally the Jewish response to AIDS at the height of the AIDS epidemic. What most people don't know about the history of HIV is that the majority of people in the early years died of malnutrition. It was what is called AIDS wasting syndrome. Your body is exposed to the virus and marshals all of its forces trying to kill it off and essentially burns all your lean body mass. So in those days, it was young men losing 30, 40 pounds of muscle mass in a very short time and literally wasting away. But there were no drugs invented yet. AZT and the drug cocktails were still, 3 to 5 years away. So food was really the only intervention. If you loved someone who was very, very sick and perhaps wasting, your only way to keep them alive while we were hoping for a drug or a cure was to feed them. Throughout tonight, I think you'll hear resonances between HIV and COVID in many different ways. Part of the beauty of our work is that it is a completely community-based organization. I like to say that it's the community serving the community. We have, in a typical year, more than 53,000 hours of volunteer time, the equivalent of 28 full-time employees. So we have about 70 full-time employees, paid staff, but you can imagine the impact if we didn't have those extraordinary volunteer support to make our work happen. I think that one thing that unites us all, no matter what our life situation, privilege, age, etc., is that at some point in our life, we'll be faced with the challenge of caring for those we love with a critical illness. And with all the resources in the world, I I'm sure you would agree, it will be the hardest thing that any of us will ever do. But we do have a lot of privileges in terms of stable housing and perhaps money in the bank and food in our cupboards and a caring network and stable mental health, et cetera. When you start to strip those away and you start to understand what our clients face. So they're facing a variety of illnesses, as you'll see. They often are in unstable housing. They are living in poverty. They are very isolated. They don't have family coming to their door. So when our delivery driver arrives and brings them meals, it is literally the gift from the community. It is the sense that they're not forgotten, that the sense that there's a caring and kind community out there looking out for them. And we're really proud that just before the pandemic hit, we expanded statewide. So we're now able to offer this across the state, which I think is so important. There are three elements to our program. The first is the idea of beautiful food. The very first thing we learned in our program was that sick people have no appetite. So if you bring them mediocre food, which is what you might expect from a large institutional feeding program, you might expect sort of the food that we saw in our high school cafeteria. But that's not going to motivate people to eat. The effort would be wasted. So really, we have to really focus on both culturally appropriate food, appetizing food, and locally sourced food. So we are partnering with local farms. We're doing most of our purchasing locally. All of our fish comes from local waters. Our beef comes from a farm cooperative in Vermont. And we get about 100,000 pounds of donated produce from farms every year, gleaners and local farms that would otherwise be plowing under surplus produce. And that is so important to our kitchen. I'm going to tell you more in a minute about our medically tailored diet plans. But in addition to that, we're offering our clients nutrition counseling and education. So while they're on our meals program, they have the opportunity to pick up the phone and call a dietitian and say, you know, I've lost my appetite because I'm going through chemo for cancer, or my doctor changed my meds and I've developed GI issues. And the dietitians are there as often as they choose to call. And sometimes it's just calling because they've had bad news or they're sad, and we become their only connection to the outside world. But really what makes our program most unique is what are called medically tailored meals, or diet plans that we offer people. Community Servings offers 15 different diet plans. And what's unique about medically tailored meal programs is that you can cross-prescribe multiple medical diets. So I always like to use the example of my best friend. This is a gentleman, he's mid-60s. He used to be a chef himself, very talented, Italian, loves to eat. He has advanced diabetes, and his diabetes has led to kidney failure. He's on a transplant list. He is on dialysis 3 or 4 days a week. He isn't able to get out. His mobility is difficult. He walks with a cane. He has had strokes. He's had heart disease. He's had a quintuple bypass, and is not unlike most of our clients. So you get a picture of what our clients are like. Now, my friend Don needs a meal that controls for glucose, potassium, phosphorus, vitamin K, and sodium. If any of us were to run out tonight to Whole Foods and I gave you that shopping list, I wonder whether you'd be able to pull it off. I really feel like unless you're a registered dietitian, it's an impossible feat for any of us to do without a lot of study and preparation. But that's essentially the service Community Servings offers to our clients, is that we can cross-prescribe multiple medical diets into the same meal, and yet the food looks just like what your grandmother made. It's homemade soup stocks, there's no processed foods, and it's that loving gift that also happens to be as tailored as a prescription. What we offer our clients is 5 days worth of food delivered once a week. So we're going to provide them with lunch, dinner, and a snack for 5 days. And what's charming about our program is that we also take the holistic viewpoint that you need to feed the whole family. Because if you bring a meal to a sick parent, as many of our clients are, they're going to give that first meal to their child. So if you want to have the impact of feeding that sick person, if you really want them to get healthy, you need to be providing a meal for their spouse or their caregiver and any children under the age of 18. So it's whenever possible, we take that kind of broad, holistic approach to the program. As I mentioned, in order to do that, we need a lot of volunteers. It's many hands make light work in the classic sense. And so we create a place of joyfulness for people to come and help us. And, you know, we talk about isolation amongst clients, but so many of us are dealing with isolation, particularly right now in a COVID world. But seeking, you know, you're new to the city, you're single, you don't have connections, having a place to go where you can do good work, but also meet people, I think is so important. And that's really what community serving is trying to offer. We host, as the slide says, in a non-COVID world, we're hosting 50 to 75 volunteers per day. Since COVID, we're hosting more like 25 to 30. And yet still having to produce the same amount of work. To give you a sense of our organization and our clients, you can see on the left our funding. We are blessed to have 4 or 5 different funding sources, which makes for a very stable organization. We are doing good in the community, but we are also a business. And as Catherine mentioned, you know, I approach it very much as an entrepreneur in the community, and having stable funding from philanthropy and government HIV contracts and insurance contracts, as you'll hear, and our events that we're well known for, is so important. But what I think is more interesting is the graph on the right, the chart on the right, where you see the variety of our clients' illnesses: HIV, cancer, kidney disease, diabetes, heart disease, etc. 71% are living with multiple diagnoses, 94% are living in poverty, and 60% are under the age of 60, which is not necessarily what you would first think of when you think of critically ill and hungry clients. The challenge for us has always been that as fast as we can raise the money, and we have a pretty robust fundraising operation and extraordinary generosity from the community. We raise about $5 million a year through philanthropy. The need is always greater. We are the only medically tailored meal program in the 6 New England states. Up until February, we were feeding only Eastern Massachusetts. And we were, for at least for the last 5 years, carrying a waiting list because we couldn't raise the money fast enough. And that our board felt was sort of an untenable situation, that we can't have people waiting to be fed. So we really looked around to look at other revenue sources. And what we discovered was that while we are certainly an anti-hunger program, a program focused on food insecurity, we always thought of ourselves as a healthcare program. The challenge was to convince the healthcare community that we were indeed a healthcare program, because they were worried about, being the untenable position of feeding the world. But we went to them about 4 or 5 years ago at the dawn of the ACA and said, we really think that we're part of your healthcare continuum of services, and you ought to consider funding us. And their response was very logical. They said, we understand it from a humanitarian and emotional level, maybe even in terms of managing symptoms, but you'd have to prove an ROI to justify it, because healthcare dollars are tight. We spend more in this country than most other developed nations, and you need to set out to do that. Luckily for us, we found a path forward with that and have actually gotten to be quite successful at doing research. Specifically, we've done claims data studies looking at that ROI in partnership with a really well-respected researcher at the University of North Carolina. We met him when he was at Mass General. And we've published studies now in the Journal of the American Medical Association that prove a 16% cost savings for the most expensive patients when you provide our medically tailored meals. Now, if you picture how expensive those patients are, you can imagine 16% is a significant savings. But in addition to that, or sort of rolling up into that 16%, is almost a 50% drop in hospitalizations for patients when they're on our service, a 72% drop in referrals to skilled nursing facilities, less ambulance usage, less visits to the emergency room. All of those are very expensive services. And so it's really exciting to see those reductions, but also significant improvement in quality of life. What that led to is a really exciting story, which is we've all heard the adage that 5% of Americans take 50% of healthcare dollars. They're what are called high cost, high need patients, or super utilizers. That's essentially the right population for community servings to be feeding because they are the sickest, the most complex diets. And that's how we market it. The research data to our healthcare partners. You can imagine these kind of savings gets a lot of attention nationally. And the agency over the past probably 3 or 4 years has grown from just one healthcare insurance contract to now 14 and is showing incredible growth in the context of COVID. We've seen a 40% jump. Most of these are Medicaid, Medicare, or dual eligible contracts. And in order to work with them, we need to mirror their level of rigor. So we are a fully HIPAA compliant organization managing healthcare data and what's called a first tier downstream related entity. So that when we receive data from our insurers, they know that we're going to keep it as secure as they do. Our latest research project, which is really exciting, just is getting off the ground right now, is our first funded by the National Institute of Health. It's a $3 million 5-year study, again, done in partnership with Dr. Berkowitz and Mass General Hospital, that's going to be looking at type 2 diabetes patients. 100 patients will receive our meals and lifestyle interventions for 6 months, and 100 will receive a grocery subsidy. And over 5 years, we'll study the data. And what's really exciting about it is that once you've proven the cost savings, then you move on to the next step in the questions of healthcare, which is who should this be applied to? What disease should get it? How long should they get it? If you have type 2 diabetes, when should you get meals based on what are your A1C levels, or are you on a transplant list? And that's kind of the path forward for our research, is taking it beyond just the cost savings, but to really say, okay, if you have cardiac, congestive heart failure, cardiac disease, you should get meals for 3 months. And if you have kidney failure, you should get them for a year or whatever it might be. But that's kind of the path forward with where we're going with research, which is really exciting and certainly has raised our profile nationally. The other side of our story is how we get the work done. And I know Catherine was particularly eager for me to share this piece of it, because I think it's as important that you, in terms of living our values and walking the talk, that how we run our business is as important as doing good in the community, and making sure that that's appropriate. So one of the things that I'm most proud of is that we've developed over the past 30 years a culture of second chances at community servings. Originally, we had many volunteers in the early years who were coming to us out of a probation program or a rehabilitation program, rehab, addiction, et cetera. And we ended up hiring a lot of those people because they were good workers. And kind of through osmosis, a third of our employees have criminal records. We are a Corey-friendly facility. And rather than presenting any risks to the organization, I would say it's some of the things that bring us the deepest and most joyful experiences. One example is that we have an employee here who is being featured on a Netflix series that premieres tonight called Trial 4, about his 22 years in prison for a murder that he didn't commit. And it took 22 years before he was exonerated and allowed to leave prison. It is working with people like that, I think, in our work that is for everybody here is some of the most joyful pieces of what we do. But we're also really focused on making sure that we're not holding, as is a challenge in the nonprofit world, I think, that we're not holding our own team in poverty. So we've been a union business for almost 20 years. We start our dishwashers and lowest wage earners at the Boston Living Wage. We have always provided 80% health benefits for both our employees and their entire families, even with the rising cost of healthcare. We think it's really important that our team is safe, healthy, and completely valued in the work that we do. Most recently, it has been a tremendous challenge for our team in the context of COVID. It was, a dark day around March 14th when we saw all the businesses shutting down. It wasn't clear yet whether that community servings was deemed an essential service, as we were, and that we had to find a way that we could keep the meals going out to our clients who were the most immune compromised and the most at risk for COVID, while also keeping our staff and volunteers safe. If our driver is going out door to door, how do we make sure that he is not the super spreader that brings the disease from one client to the next or brings it back into our kitchen to our staff and volunteers? What we did, and what is really a powerful case study, is we developed really rigorous safety protocols that now are kind of the norm, but in the early weeks of the pandemic weren't. So immediately we started taking temperature checks at our front door for everyone coming in our building. We did contact tracing for everyone, whether you were delivering product to us, you were our plumber, you were our CEO, or you were a volunteer. But knowing who's in the building, we invested significantly in PPE, and we developed a way to deliver meals that we call the contactless delivery, where our driver brings the meal bag, sets it down on the threshold, rings the doorbell, and steps back 6 feet. He's wearing gloves, masks, and feels safe enough to go out and do these deliveries day in and day out. And with that, community servings has stayed open throughout the pandemic. We have yet to have an infection amongst our team, knock on wood. And our clients have known that throughout the scariest phase of anyone's life, they feel secure that we are there for them and that the community hasn't forgotten them. One of the fun things I think that we've developed over 30 years is the idea of how do we make sure that we leverage the resources the community has given us in as many directions as possible. So after 30 years of preparing meals, we have a pretty sophisticated kitchen. We have good equipment, we have a great team, we have strong volunteer resources, but can we do more with that? What else can we do? And one of the things we thought of was all of those employees who'd come out of challenged backgrounds. They were in recovery, they were a reentry population from prison, and how successful that was. And what we developed was a second program called the Teaching Kitchen, which is a food service job training program for people with barriers to employment. Typically, our trainees are facing 4 or 5 different barriers. They have a criminal record, they're newly in recovery, struggling with addiction, they have mental health issues, they're homeless, and they have a really hard time finding a job. the food service industry is in a non-COVID world, is a great industry for folks like that. And we knew that we had a lot of connections. So what we developed was a 12-week program where we teach people how to work in the food business. We give them the life skills and the job skills to be reliable employees. But the beauty of it is that they come in thinking that they have no value. If you know the expression, the unwashed, they feel like they are discarded or the lowest caste. And we say, no, 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 we need you as much as you need us, because while you're getting job skills, you're going to help us feed sick neighbors. So the person right down the hall or down the street from you might be getting meals that you helped us to prepare. And with that message, what you see is that the light comes back in our trainees' eyes. They literally discover self-value, self-confidence again. And we know that that none of us can get jobs if you can't sell yourself in that way. So programs like the job training program, like the local foods program, like our research, are all about trying to leverage our kitchen in as many directions as possible. So the last piece of the story, I think, is about food justice, racial justice, the pandemic. I think that, as certainly a privileged white man, I think that racial equity and the conversations that have been born out of the deaths, the murders of George Floyd and Breonna Taylor and so many others really challenges all of us to dig deeper. To understand what systemic racism looks like in our own lives, in our businesses, in our communities, and to pursue that more perfect union that is described in our Constitution, because we need to challenge those assumptions and we need to dig deeper. I think that we're at an inflection point, and to me, I'm very optimistic that we are actually going to make progress in a way that we have not over 200, 400 years on these issues. I also want to share that here at Community Servings, I think one of the things as an entrepreneur that excites me is how do we live that conversation, and how do we make sure that we're doing everything we can for our employees to build generational wealth, because we all know that the way that we have risen up over generations, particularly white people in America, is to own a home, is to have savings for retirement, is to have something to pass on to our children so that they can buy a home, pay for their education, et cetera. So I think one of the fun is probably the wrong word when talking about racial equity, but I think it's exciting to think about what else could we do? How can we restructure our retirement benefits to better build that wealth for people, et cetera, within the limits of being a nonprofit business. I also want to touch on that you probably know that people of color are disproportionately impacted by COVID. They are much higher risk for hospitalization and serious ramifications of the illness. But the rise in food insecurity in Massachusetts is also really striking, and maybe not something you know about. It has doubled since the beginning of the pandemic, increased 59%. 1 in 7 people in Massachusetts population are living food insecure, living in hunger, and 1 in 5 children. 20% of the children in Massachusetts. And as a state, Massachusetts is projected to have the highest increase of any state in the country, which is really disconcerting. I think too, it's about hunger. It's also about food access. And I think that's where we can all connect to this, because in a COVID world, we have all had trouble getting food. For many of us, it's how do I get onto an Instacart delivery route, or are there enough paper towels at the store? But for other people who can't get out of their homes, it's even more dire. They don't have a grocery store near them. They have to take 3 buses. They're already sick. that anywhere, once they step out of their house, they're worried about the virus. One of the saddest stories I heard last week was our drivers delivering to people who said they hadn't been out of their home in over a month because they didn't have a mask. They had no access to masks, and they knew that they weren't allowed to go out without one. If you look at the chart here, it gives you a sense based on race, the impact of food insecurity in Massachusetts. So look at that blue line and the orange line, and you see what Latinx and Black populations, Black and Brown community members are living through compared to white populations. And you see the struggle across Massachusetts to bring food boxes, to bring meals, to get more food into pantries, here at Community Servings, to raise the money, to feed more people. As I mentioned earlier, we've seen a 40% increase in demand for our meals just since March. That's the kind of growth that we had planned to see over 3 to 5 years, and we've seen it over 3 to 5 months. So raising the money to be able to feed more people, to be able to maintain the COVID protocols and pay for the PPE is so important to the work of our staff and board and supporters. I think the inequities are really sobering. And then the last thing I wanted to say was kind of bring it back to a happy thought, which is that I think for Community Servings, certainly the reason of most of our team that have been here so long, board members and supporters have been with us so long, certainly for me to have been involved for all 30 years, it's that idea of bringing a gift of beautiful food. Every day our drivers are knocking on 300 to 400 doors. In the course of a 5-day week, we're feeding 1,500 people in a week. And every bag that they bring is a beautifully prepared bag of food. It's really the saying to somebody that no one is knocking on their doors, no one's checking on them, but we haven't forgotten you. The community is here. And it's not just our driver or our staff, it's really the whole community coming together. And I think tying back to the themes of Old North, I just think that it's the power of what that active citizenship can do to really change people's lives. We're in the business of engaging the community to serve the community and finding opportunities for you as an individual to make a difference. Because I find for me, as a maturing adult, the most rewarding thing that I do is that idea that there is meaningful work to do by caring for those who don't have the blessings that I have been born with and received, but also doing it in a joyful way, because I think we all struggle, particularly in a COVID world, with the darkness, with the isolation, with the depressing news, and to have meaningful work that we can do as a volunteer, as a donor, as a community member, or as a profession is really about, it may sound hokey, but I really feel like it's about bringing light into that time of darkness and creating ultimately a place of joy. And with that, I think we can open it up for questions. This is a picture of our brand new building that we opened last year in Jamaica Plain. And I hope you will perhaps come and visit us after the end of the pandemic, or perhaps come and volunteer in the meantime. Check us out online at www.servings.org. And know that, like Old North, we are committed to a vibrant city and a caring community. And with that, Catherine and TJ, I think we can open up for questions.
Thank you so much, David. This was an extraordinary exposition of the way this agency has evolved over 30 years. Can you imagine people making a hot meal and bringing it to someone in need? And now we're talking about 5-year research projects, changing the face of the way we deal with health and think about food and the way we care about one another. It's truly a way of creating a world I'd like to live in. So thank you.
Absolutely.
Yeah. Okay, so please, everyone, I'm sure you have questions for David and about the agency, its work, maybe his leadership style, and we would very much welcome them. We have first question is, do you know of any similar programs in other states?
Oh, great question, Nikki. Yes, so there are programs like ours there are about 12 or about a dozen programs like ours around the country. We all grew up out of the HIV epidemic. Many of them grew up out of one woman feeding her neighbors and growing the program that way. And we're a really tight network of programs, and we teach each other. One of the exciting programs Community Servings is doing right now is to lead what we call the Foodist Medicine Accelerator, where we're teaching what we do here and what I've shared with you tonight to other food programs around the country so that we can spawn more programs. 12 programs can't begin to feed all the critically ill, hungry people in America. But the research we're working will lead to the opportunity for insurance to feed people in everywhere from Detroit to Dallas to Cedar Rapids. So we're working on a program now to teach 4 other agencies a year to do the same kind of work with the same kind of rigor and work with health insurance along the way.
Uh, Next question is, if someone wanted to get involved, what's Community Serving's greatest need? Volunteers, food donations, monetary donations, something else, everything, all of the above?
I would say D, all of the above. Everything that we do is through the generosity of the community. So whatever resource you can offer us, whether that's the talent to peel carrots or the blessings to be able to write a check, or give through your donor advised fund. All of those things are incredibly important to us. One of the points I didn't mention earlier is that when we prevent one night in the hospital, we save enough money to feed somebody for 6 months. So it's a really smart business investment if you're a business person. But if you're a humanitarian, as we all know, the gift of someone's next meal when they don't have anything else in their cupboard is so powerful.
So we have a question about pie in the sky. Is it happening this year? Could you share how it got started and how it scaled up?
Absolutely. Great question. So Pie in the Sky, you might know, some people know it better than they know Community Servings, is our Thanksgiving pie sale. And it was early on in the AIDS epidemic, one of the industries that was most hit by AIDS, much like COVID actually, was the restaurant community, where they had people on their staffs who were sick and dying. And so when Community Servings was born, they were the first businesses to support us, and they've been incredibly generous to us over 30 years. And our pie sale was born out of that kind of old American idea of let's throw a bake sale. And so when I was a volunteer, I went to friends in the restaurant business. That's the field I came from originally. And I asked them if they would donate pies and we could sell them like Girl Scout cookies. The first year we sold 1,000 pies. Last year we sold 25,000 pies. It is the world's greatest bake sale and generates close to almost between $750,000 and $1 million for Community Servings in a non-COVID world. The challenge is it's all about many hands bake light work. We have 150 kitchens baking pies, 200 people sorting pies, 120 locations across the state distributing pies. All of those things are very hard to do in a COVID world. I'm incredibly proud of both our fundraising team and our volunteer fundraising committee because they have designed a COVID-friendly version of this. We are selling 7,000 pies. They all come to your table completely sealed. They come in a picked up outdoors with folks wearing PPE. And we're really trying to communicate the message that if you need a pie, buy one before they sell out. But also think of making a donation without taking a pie, because we can't ship as many pies as we normally would. 7,000 versus 25,000 this year. And so we're really looking for donations big and small. $30 is the price of a pie, and that's the price of feeding one of our clients for an entire week. So the website is pieinthesky.org. It is a wonderful feel-good Boston tradition, and we were really focused on making sure we didn't lose that in the context of COVID, because I think we're all starved for any kind of tradition as we go into the holidays and the winter season. And so we're really proud to be continuing the pie sale this year.
So, David, here's a question. Given the phenomenal growth of the scope of the agency, how have you managed to keep it true to its roots? How have you kept its soul over all of these years?
Well, I think we all keep each other honest, first of all, in that the mission and the value system has become ingrained in the first people who were first involved. I think of our founder, Sheila Dechter from the American Jewish Congress, to our early board members, to staff who've been with us for 25 plus years. And I think we sort of carry it forward. But what I love about the program is that you could talk to our dishwasher or our delivery driver or our receptionist, and they would tell you a different story than I might tell you, but it's the same story in that it's the same value system and the same impact. They are all living with someone in their lives who has struggled with an illness, and they know how important the meals are. So what I think is exciting is that we've been able to keep evolving over 30 years. If we were still feeding 30 people with HIV in just Dorchester and Roxbury, I'm not sure that we wouldn't be as robust a program, but we wouldn't have the opportunity to innovate in the way that we do. So I credit our board and our management team with constantly evolving. And COVID is no different. I think the changes we've made, the pivot we've done in the course of COVID will inform what we do post-COVID. There are, like all of us, I keep asking people, what's the silver lining to COVID? What's the good thing that's happened to you? Is it, the virtual lecture series for Old North that can draw a bigger national audience? Is it Zooming with your friends and family? There has to be an upside to this. And for community servings, I think the innovations we've done to make sure that the people still get fed, many of them will continue because they're just smart social intervention and smart business practices.
Do we have any other questions? Well, if you do, you can certainly contact the folks at Community Servings. I know that they're very proud of the work they do, and very justly so. And what I would like to say as we start to get ready to close is this, that very often we think that heroism and opportunities to do something great, oh, well, maybe they won't present themselves to us. People like Revere and Newman and Pulling, those are heroes for our site. Hancock, they were different, times were different, but that's not true. We all have opportunities to change our world and to take action. And Community Serving's story is one of those stories. And so as we move forward tonight and as we enter the holiday season, look around. I'm sure there's something, however small, that could bloom into something large. And I would really encourage you to take that spirit of active citizenship with you and see what that might be. So thank you all very much tonight for coming, and we'll see you in 2021. Night now.
Thanks, everybody.
Thank you. Wonderful.
Thank you. Great job, Dave.
Thank you.
Miss you all.
Thanks, David.
Thanks, Mary Catherine.
See you soon.